We brought the technology of decompression in 2006, and ever since we've been able to help patients who have chronic lower back pain and sciatica as a result of a disc condition such as disc herniation, bulging disc, spinal stenosis, and degenerative disc disease. I found this treatment to be something that will take the patients a little bit further into getting rid of the pain without going to more drastic measures such as injections, spinal surgeries, which typically have some success but limited.
I came to see Dr. Akavan with sciatica down my left leg. I had severe back pain. I could barely walk, could barely bend. I had gone from being a long-distance competitive runner to somebody who was completely idle, couldn't move, totally depressed. It was awful.
When a patient is on the decompression unit, the whole purpose of the treatment is to reduce the intradiscal pressure, which is typically increased in a disc condition such as herniation or bulge. So when a patient is in this position, we are targeting one specific disc during the treatment to reduce that pressure inside the disc, and we achieve that by how we position the patient on the table and how we angle and target that disc.
During the treatments, I felt comfortable. It was really natural. Sometimes I even fell asleep. It wasn't painful. It wasn't uncomfortable. It just seemed like a really natural position to be in.
My experience on the DRX machine was that it was very relaxing, no pain whatsoever. My symptoms 2 years ago were that I had extreme lower back pain in my L3, L4 and L5 joints, and was affecting my lifestyle.
The way this decompression units are different than your traditional traction machines is that we're able to bypass that basically inherent natural reflex of the body to resist the pull. So the computer that generates this force, it is bypassing that by basically fooling the brain from firing those reflexes, so we can truly achieve the negative pressure and truly create the spinal decompression effect.
Well, at the time I was playing a lot of old-timers soccer and tennis 3 times a week, and it was affecting my sports to the extent that I couldn't play soccer at all.
The success rate with the decompression therapy has been amazing, what I've found with most patients. It is not a cure-all treatment, but the treatment has been, for most part, effective in dealing with conditions such as herniated disc, bulging disc, or degenerative disc disease.
It changed everything. I went from being, athletic and energetic to spending 6 months on the couch, being absolutely miserable and in pain 24 hours a day.
My quality of life since the treatments has improved dramatically. I'm able to play soccer once, sometimes 2 times a week for an hour and a half each time. I am also playing tennis 3 times a week and playing in Masters tennis tournaments. So my quality of life in terms of my sports has improved. My quality of life in terms of my business and my home life has also improved.
I feel fantastic. My entire life has changed. I'm training again for a half marathon, my first race since I hurt my back. I'm out and about all the time. I sleep well. I can walk. I can run. I can bike. I have my life back. It's phenomenal.
Absolutely. We had few cases of patients who are basically carried into this office with either on a wheelchair or on crutches, not able to put any weight on the leg that have sciatic pain. And within few treatments, obviously, we were able to lessen the pains, and within a week or two, like a miracle, they were able to actually put weight on their leg and start to sleep in their own bed instead of sleeping on a recliner. So those are the kind of things that we see typically in patients.